With all its important metabolic functions, the liver is packed with enzymes. In this video, we'll take a look at the different types of lab tests relating to liver enzymes. When liver tissue is damaged, enzymes can find their way into the circulatory system. The enzymes Aspartate Aminotransferase and Alanine Aminotransferase are most present in tissues with a high rate of metabolic activity, such as heart, liver, kidneys, and muscle. These two enzymes were previously known by different names in literature. The mouthful that is serum glutamic oxaloacetic transaminase is now known as AST, and serum glutamic pyruvic transaminase as ALT. Another few enzymes relevant to diagnosis of liver disease are alkaline phosphatase, 5' nucleotidase, lactate dehydrogenase, and Gamma-Glutamyl transpeptidase. AST is released in abnormally high levels in the event of cell death or injury, and so elevated levels could suggest disease processes such as acute hepatitis, cirrhosis, hepatic necrosis, or infectious mononucleosis. Large amounts are found in the liver but can also be found in all tissue types, so elevated AST isn't particularly specific to liver disease and may be the result of disease from another organ. If there is an abnormal increase in AST concentration in the blood, the amount of the increase will be relative to the amount of time between cell injury and testing. Evaluation of AST is a decent way of diagnosing liver disease before jaundice occurs. ALT is more specific for the liver than AST. It's an enzyme necessary for the Krebs cycle, and because the liver does a whole lot of biosynthesis, it has the largest amount. It is slightly elevated in disease states of acute cirrhosis, metastasis, and pancreatitis, and is hugely elevated in hepatocellular disease and hepatitis. ALT values are usually used to assess a person who already has jaundice, because a neat differential that you can do is, if jaundice is present without an increase in ALT, then the cause of jaundice is likely to be hemolytic. ALT is commonly used in conjunction with AST to differentiate disease types. A large increase in AST while only a minimal increase in ALT would suggest that the liver isn't the source of disease, because hepatocellular damage should cause a similar increase in ALT. This type of ratio is most often caused by heart damage. Presence of cirrhosis or metastasis is suggested when both AST and ALT are elevated, and the elevation of AST is greater than the elevation of ALT. Presence of acute hepatitis or non-malignant obstruction is suggested when ALT levels are more elevated than AST levels. Something to note is that ALT levels remain elevated for a longer period of time than AST, so ALT levels may not update immediately with a change in disease state. ALP is an enzyme produced mainly by the liver, bone, and placenta. It's normally excreted in bile, so a significant increase in ALP is associated with obstructive jaundice. Higher levels of ALP are normal in children with growing bones and in pregnancy. Because ALP is associated with obstruction of the biliary system, diseases causing an increase in ALP will also be causing biliary obstruction. Some such diseases include biliary tumours, hepatitis, metastasis of the liver, metastasis of the pancreas head, or cholelithiasis. An increase in ALP could also potentially be caused by hepatic blood flow obstruction, as caused by congestive heart failure. Elevations of this enzyme are seen in the same diseases as in ALP, so this one is kind of like an alternative to ALP that doesn't rise in bone disease like ALP might, and rises less in pregnancy. However, concentrations of the two enzymes may not both rise in cases of biliary obstruction, so a normal 5' nucleotidase value doesn't rule out hepatobiliary disease. This enzyme is pretty much the same as AST in that it can be found in all tissue types and isn't greatly specific to the liver. LDH is actually less specific than the already not so specific AST, so for this reason it usually isn't used to evaluate liver function, while the other tests are available. In cases of liver damage, you'll see an increase in LDH4 and LDH5. This beefy sounding enzyme transports amino acids and peptides across cell membranes, and is mainly found in the liver, pancreas, and kidneys. This test is most sensitive to detecting alcoholism, but large elevation could suggest biliary obstruction or liver damage. If it takes your interest, you can find a more overview-y type video on liver functions called Lab Values Liver on my channel. That's all from me today. Cheers.